Hi, I'm Dr. Penny with Carolina Chiropractic. Today I am here with a patient who is, how many weeks pregnant now?
I am 34 and 3 days.
Okay, and you have how many babies in here?
I have 2 babies.
You have 2 babies in here. And how did you hear about our office?
I was actually referred by 2 friends of mine. So
Okay.
they were both very close to C-sections. They were 39 and 5 days each. They both had breech babies, 1 baby each. But they came into you and they were...
Babies flipped,
Yes.
and got them to be able to deliver naturally and everything else, and they were thrilled.
Yes.
And, now this is not your first pregnancy.
No.
Okay, and both of your babies are breech.
They are both
Okay.
breech.
And we saw you one time last week, and we're kind of following up and checking on everything. And I think you have an ultrasound later this week to
Yes.
confirm how the babies are, correct?
Correct.
Okay. How did you feel after your first treatment?
I felt great. It was easier to walk. It was easier to sleep and get out of bed.
Okay. And if you don't mind just turning it a little bit.
Sure.
So when you first came to me, I took a picture, but it was, your belly was off-centered and kind of almost to your left a little bit. And then after you stood up, it was a lot more centered. Not perfect, but a lot more centered. And you can see that it's off just a little bit to the left. Not much, but, and we'll kind of check that again afterwards. But that's not always the biggest factor because some kids just hang out on one side or the other. You got 2 in there, so like, but you were like, I feel straighter, I feel, and everything else. So, all right, let me have you lie on your back with your head right here.
Okay.
The technique that we use today is called Webster's Technique. That's what I used with your friends when they came in, and it is pretty effective for flipping babies. It's not that crazy invasive or anything like that. But if you can come close and kind of see how her belly is just kind of off-centered, just a touch. Oh yeah. And so there's 2 in here. So I'm just gonna feel around and feel the little ones. And you're not finding out the genders of either one, correct?
Correct.
Okay, we didn't find out with ours either. I think it's a lot more fun. There's very few good surprises in life. And might as well enjoy the ones that you get, right?
Yes.
Now, did you find out with any of your other ones or no?
We only found out with our 4th,
That's what I thought you said.
and that was our only girl. The rest were boys.
So. Alright, I'm just kind of feeling around. They seem to be asleep right now, and that's okay. I'm sure you're going to feel them move a bit afterwards. I'm going to just kind of bring both knees up and kind of see how they're uneven to start. And some of that's just because of where the belly gets and everything else. You can kind of see that their pelvis is just kind of twisted because this knee's a little higher, but doesn't go up as high that way. Or anything like that. And so what we're going to do is we're going to bring this leg out and kind of work through here on the ligaments and on the muscles. You okay?
Yes.
Am I too? Okay. If I get too strong or anything like that, just tell me. Okay. It's not going to hurt my feelings. I can handle it. But tender there, correct?
Correct.
Okay. Your adductors, the muscles in there in which I'm working, they compensate for a lot of the pelvic floor, and so a lot of times we do this to help. You can see how you just kind of want to rotate out that way a little bit more. The babies just kind of want to fall that way. And that's okay. They may stay a little off-centered the whole time. Like I said, some babies hang out on the left, some babies hang out on the right. When they do the ultrasound this time, ask them where the placenta is.
Okay.
I believe it's up here, but I'm just curious because I don't have an ultrasound where exactly they believe that it is.
Okay.
Okay, we're just going to stretch you for a second. You okay?
Mm-hmm.
You okay? You feel that stretch, don't you?
Yes.
All right. Am I too strong? You tell me to back off. Check the legs. So this one's showing a little short, so we're just going to kind of pull it a touch, right? Good. You okay?
Yes.
Good. Okay. And I'm going to adjust the lid back a little bit. Cross your arms. Breathe in and all the way out. Another example of bellies that stay uncentered are ones with moms with scoliosis. They're almost always, their belly stays off center. Can you come around here and kind of show how even just that one, the stretching work in the pelvis and everything else, how all of a sudden the babies are starting to look more centered and everything else. It's quite a significant difference. That's why I wanted to point that out. What you're going to do now is you're going to lie on your side facing me. Bring this up. Cross your arms. What we're going to do is real simple. We'll lower you down a touch. I'm tall, but I'm not quite that tall. Just relax, ready? Good. Just that small little adjustment and roll to the other side. Now you got a lot more cracking or popping or whatever you want to say on your first adjustment, and that's totally fine. And I believe that was your first adjustment by any chiropractor, correct? Like you hadn't seen a chiropractor ever, is that what you told me? Or no, did I have that wrong?
Just one time. That was it.
Okay.
Years ago.
Okay. Just relax, right? There, nice and easy. Good. And line your back for me. Good. Sorry, I'm gonna get right here. Okay. Pull that leg just another time. We're going to adjust the neck for a second. I've shifted off a little bit because I was working on your pelvis. Just right. Good. What I'm going to do is I'm going to sit you up for a second.
Okay.
Okay? And swing your legs off that way. Alright. I'm going to try to leave this enough room for you. Let me have you lie on your stomach with your head right up here.
Okay.
You comfortable there?
Yes.
As comfortable as you can be, right? There are armrests here if you want
Alright.
those. And so what we're going to do is we're just going to stretch it out for a second here and then do a little bit of muscle work. A little bit. You okay?
Yeah.
Good. And no, you don't, not everybody that does Webster's does all the stretching and everything else. I have found in 11 years of doing Webster's that the response is much better. If you work the whole body as opposed to just coming in and making a couple little adjustments and just relying solely on that if you do a little bit of the muscle work, the body relaxes, it accepts the adjustment better, as well as it's much more comfortable for the mom. I didn't say while I was doing it, but because I'm sure that's tender a little bit, right?
Yeah.
Yeah, if it's too much, you can tell me to back off, that's okay.
Okay.
I'm still kind of learning your threshold of what you can handle. And everybody's different. Some people, I'm giving them everything I got, and they're like, you can go a little harder. Some people, you're barely touching them, and you're like that's enough. And either's fine, you know, like I just got to know where that limit is so that I can do the right amount of therapeutic pressure. You okay through here?
Yes.
Good. It's sore though, isn't it?
It is sore.
Okay, so guys, you are a small framed woman and you have two babies out in front, and it is going to tax your low back right here and kind of exhaust these muscles, and you can feel that, correct?
Correct.
All right. And then you have a few at home that you have to tend to as well, correct?
Correct.
Right.
Forward.
There are 4 at home. This is 5 and 6, correct?
Correct.
Yeah, so, I have 2 at home, and I'll just jokingly say I don't know how you do it, because it's exhausting, you know.
It is tiring, but I
Right.
have help. My mom's here.
That's good, that's good. All right, so I'm just gonna get in here a little bit with my elbow. If it's too much, again, tell me. There's a little more tender on this side than the side I'm on currently, correct?
Correct.
I'm gonna get right on this side just a touch. Good. And then I have one other adjustment that I'm gonna do with you on your back in a second, okay?
Okay.
All right, so whenever you're ready, you can roll over.
Okay.
So where the front of the pelvis comes together is a little tight and tender on you. I'm gonna use something called an activator. I did not do this last time with you,
Okay.
but it's just gonna adjust the front of the pelvis.
Okay.
So again, it's an activator. I'm just gonna come in here on the front of the pelvis and just kind of tender, right? Okay. I didn't think it wouldn't be. I always thought it would. I would say that's one of the more easier and comfortable adjustments that I'll do, period. You can come on up.
Okay.
All right. And then I want you to stand up, move around a little bit, and tell me how everything feels.
A lot better.
Right?
Yeah.
A lot looser, a lot better.
Yes.
And if you look at the camera, you can see that the babies are a lot more centered now. They're not hanging off to the left nearly as much. Your belly button probably feels like it's more in the center.
Yes.
Whereas when you first came to me, you were like, it feels like it's over here kind of thing. And that's okay, you know. We're getting the kids to move. And they did feel like they were in a different position. I'll go over about that with you off camera or whatever else. So I think that they're getting, if they haven't flipped already, they're getting ready to get in position.
Okay.
And hopefully we'll have confirmation of that with the ultrasound. Granted, we're pretty far out, so they don't need to be in position today or
Yes.
anything like that, but being able to get there with twins is important, right? Okay. All right, good. Anything else, any questions or anything like that?
No, it feels really good.
Good. All right. Like the video, comment if you have any questions or anything you'd like to say, and let us know. Thank you. Subscribe.